Margaret is sitting at her computer comparing two Medicare Advantage plans, and on paper, they look almost the same. Same monthly premium, same doctors, same little extras for dental and vision. But one has a row of stars next to it, and the other has fewer. And she has no idea if those stars actually mean anything, or if they're just decoration. Here's the thing. Those stars are a government report card, scored from 1 to 5, and they can tell you in about 3 seconds whether a plan tends to treat its members well. Today, in plain English, what Medicare's star ratings really measure, how to use them to pick a plan, and one special rule that can let you jump to a 5-star plan outside the normal window. No sales pitch, just the map. Let me say it simply up front. Every year, Medicare rates the private plans. That's Medicare Advantage and the Part D drug plans, on a scale from 1 to 5 stars. 5 stars means excellent. 4 is above average. 3 is average. 2 is below average. And 1 star means poor. So when you see those stars on a plan, you're not looking at marketing. You're looking at Medicare's own grade for how that plan actually performs. So what are they grading? This is the part that surprises people. The stars aren't about whether the plan is cheap. They measure quality and service. Things like how well the plan helps members manage chronic conditions, whether people get their screenings and checkups, how easy it is to get an appointment, how the plan handles complaints, how quickly it answers the phone, and how members rate it overall. It's dozens of separate measures, around 40 of them for the bigger plans, covering health outcomes, the member experience, and how the plan runs its day-to-day service. All of that gets rolled up into that 1-star number. So a 5-star plan isn't the flashiest one, and it isn't the cheapest one. It's the one with a real track record of keeping its members healthy and answering when they call. That's a very different thing from a glossy ad. Here's why that matters for Margaret. Those two plans on her screen cost the same, but the 4-star plan has a track record of members getting good care and getting their questions answered. The lower-rated one has more complaints and slower service. Same price, very different experience the first time something goes wrong. The stars are how she sees that difference before she signs up, instead of finding out the hard way in February when she's sick, on hold, and waiting for an approval that won't come. The stars don't guarantee anything for her specifically, but they tell her how the plan has treated everyone else. And that's the closest thing she has to a preview. Now, where do you find them? You don't have to dig. Go to Medicare.gov, use the Plan Finder tool, and the star rating sits right there next to each plan, alongside the cost and the coverage. You can also call 1-800-MEDICARE and ask. And here's a number worth holding on to. For 2026, about 64% of people in Medicare Advantage plans with drug coverage are in plans rated 4 stars or higher. So good plans are common, but not every plan is one, and that's exactly why you check. One important caution, because I want you to use this honestly. The star rating is one factor, not the only one. A plan can have a great rating and still be wrong for you if your doctor isn't in its network, or your medication isn't on its drug list, or the costs don't fit your budget. So check those first, your doctors, your drugs, your costs, and then let the stars break the tie. Think of the rating as the deciding nudge, not the whole decision. There's also a timing detail that's easy to miss. The ratings update once a year. Medicare releases the new ones each fall, right before open enrollment, so you're always comparing plans on the freshest scores when you're actually making your choice. A plan that was 4 stars last year might be 3 this year, or the other way around. So glance at the current rating each fall, not the one you remember from before. A plan can climb, a plan can slip. The score you're looking at should be this year's score, and on Medicare.gov, it always is. And now the rule almost nobody knows about, the one that can genuinely help you. Normally you can only switch plans during certain windows, but if a plan in your area earns the top 5-star rating, Medicare gives you a special enrollment period just to move up to it. You can use it one time between December 8th and November 30th of the following year, so you're not stuck waiting for fall open enrollment to grab a 5-star plan. One catch worth knowing. If you'd be moving from a plan with drug coverage to a 5-star plan without it, you could lose your drug coverage and face a penalty later. So always check that the 5-star plan covers what you need before you jump. So here's the one simple thing to do. Before you enroll in any Medicare Advantage or Part D plan, or before you renew the one you have, pull up its star rating on Medicare.gov and actually look at it. It takes 30 seconds, and it tells you something the brochure never will: how the plan treats the people already in it. And if you'd rather have someone walk through it with you, you don't have to pay anyone. Your state health insurance assistance program, the free SHIP counselors reachable through 1-800 Medicare, will sit down with your plans, your doctors, and your medications and go through the ratings with you, with nothing to sell. So I'm curious, when you picked your plan, did you even notice the star rating? Or is this the first you're hearing of it? Tell me in the comments. It helps me know what to explain next, and it helps the next person feel a little less lost. I read every reply. If this made those little stars make sense, subscribe. Next, we'll break down what open enrollment really is, and the one mistake that quietly costs people every single year. This is general information, not advice, and we're not affiliated with Medicare. The ratings and rules change every year, so always check your own situation. I'm really glad you're here. I'll see you in the next one.